All right, let's talk about a clinical skill that is absolutely essential for patient safety, the modified Allen's test. It's a simple, non-negotiable check you have to do before any radial artery procedure, and we're going to get right into why it is so incredibly important. So picture this. You're all set to do a radial artery puncture. Maybe you're grabbing an ABG sample, maybe you're putting in an art line. But hang on a second. Before that needle gets anywhere near the patient, you have got to ask yourself one critical question. Does this hand have a reliable backup plan for its blood supply? And that backup plan, it's called collateral circulation. See, the hand gets its blood from two main arteries, the radial and the ulnar, that form a kind of loop. The whole point of the Allen's test is to make sure that if something were to happen to the radial artery during your procedure, the ulnar artery is strong enough to pick up the slack and supply the whole hand. This quick check prevents a total disaster, hand ischemia. We're talking permanent damage.
So how's it done? It's actually a really straightforward four-step process. First, you're going to find both the radial and ulnar arteries of the wrist and apply some good firm pressure. Then, to speed things up, have your patient open and clench their fist a few times. You'll literally see the palm turn pale, or what we call blanched. That means the capillaries are empty. Now for the most important part. You keep holding pressure on the radial artery. That's the one you're planning to use, but you let go of the ulnar artery. And then you just watch.
So what are you watching for and for how long? Well, the magic window here is between 5 and 15 seconds. That's it. A normal, healthy response is going to happen right in that time frame. This tiny little window is all you need to know if the hand's circulatory safety net is working. Reading the results couldn't be easier. If you see that nice pink color flush back into the palm within that 5 to 15 second window, the test is normal. That's your green light. It means the ulnar artery is doing its job, and you are safe to proceed. But, and this is a big but, if that hand stays pale and white for more than 15 seconds, the test is abnormal. That is a huge red flag. It means the collateral circulation is poor, and you should absolutely not puncture that radial artery. And hey, here's a little pro tip for you, a slightly different way to do it. You can actually check one artery at a time. So for instance, you'd compress only the radial artery, have the patient make a fist, and then open their hand. It should flush with color pretty fast, since the ulnar artery is wide open. If it stays pale, well, that tells you the ulnar artery's flow isn't good enough on its own. You can then just repeat the process on the other side. Look, at the end of the day, the modified Allen's test is so much more than just another step in a procedure. It's your critical safety guardrail. We're talking about a check that takes just a few seconds, but can prevent a serious, lifelong injury for your patient. It's a powerful reminder that sometimes the simplest checks are the most important ones we do.